because everybody says it's, like a mild flu. And I actually had thought to myself when people started getting sick, I want to kind of get this done and over with so that I could get back to work and help people. And I actually went through probably one of the more severe expressions of the virus and had at day 7 gotten much worse, had to check myself into the hospital at Mount Sinai, had to get got a chest x-ray where I saw the pneumonia before they even took away the portable device, and really had a very severe condition. And luckily I was able to maintain treating myself at home. I actually did start myself on hydroxychloroquine and azithromycin, and after 2 days my x-ray showed improvement. So I definitely was on the spectrum of more severe disease, and luckily was not hypoxic, having low oxygen. But I, simultaneously dealt with my father, who also was very ill in Las Vegas. He had been in New York. He tested positive for corona. He needed to be in the ICU, needed to be on a ventilator. And from the grace of God, yesterday was able to come off. So I'm definitely in a very unique situation of being a patient, being a provider, dealing with family members that were critically ill. This is a testament to.
Let me ask you, what is your advice to those? I mean, you've been through it now yourself. You know the symptoms. You know what it feels like. What's your advice to people who, are feeling sick at home, trying to figure out, at what stage do I need to actually go to a hospital?
So that's really a critical question, Anderson, and that's what we're doing. I think that's most effective in my practice. We're not on the front lines in the critical care setting, but we're on the secondary lines, and taking care of many people and helping them navigate that you don't need to go to the hospital. I'm practicing medicine. All of us are practicing medicine in an unprecedented time. And trying to decide, all right, somebody's oxygen's not great, but they have a little bit of a pneumonia. I think that they'll do okay. That's a really hard call for me as a clinician to make. And I've been practicing medicine for over 20 years. So for people that are home and trying to navigate that themselves, I think that this can be incredibly difficult. And certainly the best advice that I can give is, look at your symptoms. If you don't have a fever anymore, that's a good sign. If your symptoms seem to be resolving after 3 days, you're in the window of probably getting better. But if you're having more severe symptoms, the difficulty breathing, the pain in your chest, so weak that you can't move, and it's getting past the 7-day mark, that may be a sign that you need to get some medical help. But the amazing part of what's happening in medicine is we have resources like telemedicine now that is becoming very people can access. And I think that those are the type of resources that we really should be relying on in order to make sure people aren't just going to the hospital. In New York City, it's a very difficult environment because a lot of people had a knee-jerk reaction to go to the hospital. There's education barriers, there's language barriers, and we need to really make sure that people know that those resources are only for the sickest.
Yeah, I mean, there's really a last resort. Obviously, you want to try to, talk to a doctor on the phone, or you have access to a doctor, talk to them on the phone, or get whatever advice you can before you want to try to stay out of a hospital, I would assume, as much as possible.
Absolutely. I've been I practiced emergency medicine in the hospital for over 15 years. I was a patient in the ER, and I have to say, I've never felt so uncomfortable in that environment. That's my home. That's where I feel, like it's second nature. And the energy there, the uncertainty, the stress levels are just astronomical right now. So, the support that those people need is not only the personal protective equipment, but it's the emotional support. It's the time to rest. It's, it's all of the other elements that we're not even talking about, to eat, to be able to go home, to be, have some sense of normalcy, because what they are dealing with, it's not normal. And even in my practice, where we're not dealing with the most critically ill, the level of stress for all of the providers, for the people that are interacting with these patients that we know are sick, is unprecedented. So we need to really work on respecting that and giving some sort of relief for the healthcare providers that are in that situation.
Yeah.